All right, looks like we are on here. Hello, everybody. We are meeting for our Module 5 this week. I will be your leader. I have Kathy down as the recorder. Mariel will be the submitter this week, and Sarah will be our facilitator. I guess starting off, I have our readings listed on the agenda. Does anybody have anything they want to say about those or questions?
Nope.
I think so either. All right, so I think our big thing this week is to kind of just discuss what we want to do with our PowerPoint project and how we want to split up doing the work for it. It's due not this Sunday, but the following Sunday. I think it's October 2nd.
Mm-hmm.
And so it needs 20 minutes, it's a 20-minute maximum. And then Dr. Dowling did post on the announcement board a way to split it up, which I think I really kind of like how she has it laid out for the slides. And I thinking that each of us take 5 slides might be an easy split up, but I'm absolutely open to other ideas you guys may have.
I'm fine with just splitting it easy, 5 slides each, you know.
Okay.
Yeah, me too. I just have a question though. Maybe I'm just confused, but so we have to figure out what we're going to do for our project. I mean, the slides are great, but
Yeah. So I think I don't know, we can kind of just go through each of the slides and kind of discuss. So we have the slides 1 through 5. We've essentially gotten all of those completed because we have our health promotion definition. We have our target population, and then the scenario we selected. We have all that. So then she has in slide 6, describe the identified health deficits that pertain to your population. This should come from research your team conducted in the literature. This is where your data collection and your research comes in. What have you learned about this population's health deficits? So,
well, I think, Natalie, I'm confused though, because I know that for our assessment tool, we got the information and we have all that and we have our theory and our theoretical framework. But what I'm wondering about is a project. It says we're asking for funding. So
my understanding was that we are essentially asking for a way to, hang on, let me pull it up. I don't want to be incorrect on this.
Yeah, I'm just saying because slide 11 says describe how you will evaluate the project. So I'm confused about what our project is, or maybe we haven't figured.
I was going to say my assumption was that our project was essentially the rolling out our tool that we made into the DHRA and how we go about implementing our tool.
I'm going to review too, because I'm not sure if the intervention is rolling out the tool or like coming up with something based on the data from the assessment.
Right, because just having a tool is great. I mean, we just came up with a tool and anybody can hand a tool to somebody and say, okay, have this tool, but it's what are we going to do to improve the lives of other people with that tool and how we're going to market our program and our intervention. So that's what I'm confused about, you know, and how we're going to, like slide 18, describe why that DHRA and surrounding community will support or need an intervention like yours. Will they buy into our program? Is it sellable to the community? And convince me. So I think that it really has to be more than our tool. And I read one of the other groups I don't remember who it was, but I read about how they were going to work with community and grocery stores and do all these things. And I thought, okay, well, then now they've got something, a project that they're going to do from their tool. And I don't think maybe we got that far.
No, I agree. And I think, yeah, so it'll be ultimately our marketing tool.
Yeah, so I'm looking under the content and the ABPP piece section, and then the intro to the presentation says that we will implement and evaluate one small health promotion or risk reduction intervention. So I guess we'll have to come up with something to roll out to our population to either promote health or reduce the risk of obesity.
Mm-hmm.
I mean,
I'm
we
not
could
sure.
always do like, say that we're going to use the tool. Like, I don't know if we could do something like maybe like a screening fair in the community, you know, where places have stuff like that, like almost like where they do blood drives in parking lots and stuff. That where we use the tool just within the community and assess people for their risk for obesity, and then if they are at risk, we could have like resources available for them to lower their risks, I guess. Something like that. Like we could do some sort of,
Yeah, we could have a collaboration with a lot of the resources. We could have like gym membership collaborations where they could get discounts on things like that.
or like one training session free or something.
Yeah, if you sign up,
Yeah.
have a nutritionist available to speak with people.
And then there's this resource I found on the CDC website. It's called, I think it's choosemyplate.gov. And that helps people kind of like food journal and figure out where they're imbalanced in their nutrition. So that could be something else. We could have somebody that's there to like speak on the behalf of that website and how it works.
Yeah, that's a great website.
Yeah, and it could just be like some sort of fair that maybe they had at the DRHA or something, you know, to make it tie into our scenario.
Have you guys ever had, our hospital does a weight loss challenge. That's pretty cool. And they give like a really nice prize to the person that loses the most weight.
Oh.
And then other little prizes.
Hospital, they did that.
And they get prizes from the community, so they don't even have to pay for them. They get businesses to donate them.
Oh, that's nice.
That's cool.
It is cool.
Well, I really like that idea of the fair, Sarah. I think that's a really good idea.
Yeah, just to, that'd be like a good way to promote it with like just the idea and the resources within the community, and then I don't know, try to get as much turnout as possible.
Yeah. Well, and I think another thing too, a great place to maybe have this being our population is young adult, is like college campuses and things like that.
Yeah.
To kind of hit that specific targeted age range.
Oh, that's perfect.
Yeah, that'd be a good idea. So are we all kind of agreeing that we'll do some sort of fair on a campus of some sort?
Yes.
Okay.
Yeah, I like that idea.
Like we could just have registered nurses using the tool to assess people that show up, and then we can kind of direct them accordingly to what type of resources they need the most based on their results.
Or would it be feasible to use the tool in the clinics at DHRA, which would bring awareness, and then they could be directed to the health fair for two? I mean, I don't know. Do you think we could get enough people to come to a fair? Maybe it's a college, it probably would work.
And I think we could probably, have our fair kind of be spiced up to like the college population. So, have some really cool prizes available for people who come. Offer,
You offer like snacks, like healthy snacks.
Oh yeah.
College kids always show up when there's food. That would be good.
Totally.
Especially if it's free. I just feel like if it's at a clinic, there's not enough young adults that even go to the
You're right.
doctor to be
Right. That's
assessed.
not a population that they see a lot of. So I think we should
Yeah.
focus on colleges.
Yeah.
The DHRA is supposed to be in Arizona, correct? Or is it wherever?
I think it's supposed to be in Tucson, but I don't know.
Because if it's by the U of A, there's lots of college students there.
Exactly.
There are.
So do we want to I was thinking about these 5 slides, and maybe since they're not due for a couple weeks, maybe we could all tentatively be done with our portion maybe by Monday, and then we could, if everybody's free, we could meet again on Monday and go over them together. That way we still have another week before they're actually due.
Yeah.
That's a good idea.
I think that's a great idea.
And the thing of it is, though, is if the slides are supposed to be a PowerPoint presentation, I don't know how feasible it is. I mean, we're not going to want to put everything that we want to say in the slide, because I don't know about you, but when I speak, I've spoken a couple times on Baby Friendly Initiative, you just put things on the slide that triggers people to look at the slide, but not have all the information that you're going to say, because you don't want to give a presentation just by reading.
Yeah.
Right.
So
I don't know, I've noticed with this program though that since they give you a time constraint, like you almost have to put everything on the slide and then speak on behalf of key points, just so all the information is presented to the professor, and then you're still getting your main point across while you're talking.
Maybe like as bullet points.
Yeah, just because I know that, I mean, you know, when you get like 15 minutes to go over an entire evidence-based practice project, like you're going to have a lot more to say than 15 minutes worth. So some of the slides can be kind of lengthy, but then that information is still there for the professor.
Okay, that's true.
Yeah.
That's true. It wouldn't be like what we would really be doing if we were giving a presentation.
Yeah.
And she has actually a template for the PowerPoint available. I'm going to pull it up and just see what, because it looks like, if I click the right button.
And then I read somewhere too, while you're looking, it said that we need to be proficient in advancing through a PowerPoint while we're recording. And I guess I'm going to have to do some research on that, because I've never like screen shared.
I had to do that for another class where I pulled up the PowerPoint and went through it as I was on here. So I'd be happy to take on that role for when we do, because I know how to. It might take me a minute to remember how to do it, but I've done it and remember how to get us through.
Oh, good.
Practice on Monday.
Yeah, but yeah, maybe we'll practice on Monday. Just do a little practice session, and we can throw up one of our PowerPoints and just see how it goes with us going through it.
Oh, that's a good idea.
Actually, I could probably practice right now as I pull up this PowerPoint template and see if it will come up for us. But
where do you get the template from, Natalie?
It is on. So it's actually under. It's under the ABPP. Hang on, it's opening here. It's under the proposal presentation, assignment 6.1. It showed up under this week's module 5 stuff though. And there's a PowerPoint template. And it says here that each presenter must list his or her name and the narration or script for the slide on the PowerPoint presentation notes page. So the screenshot, let me see if I can screenshot this to you guys here. Nope. All right, so when I click on this, I'm going to screen share it over to you guys here.
Cool.
Of course, I do have the slowest computer on earth, so I'm really sorry.
Oh, cool.
Well, it's down there, but all I see is Sarah on the screen.
I think
There it
Natalie.
goes.
Sorry, guys.
Yeah, it'll just have to be, I think what'll be weird about this is whoever's talking is the big picture. So
Well, it's staying up there now. I don't know what she did, but
There was an option. There was an option to have it display for everyone, so we'll be able to have everyone's displayed as we click through. And so I should have this option to put the PowerPoint up, and then we'll be able to click through it.
okay, good.
okay. Yeah, because that's all that's showing now. So you would have the PowerPoint and then you would just advance it because we can't advance it.
Yeah.
Okay.
Yeah, I think whoever takes charge of the whoever puts it up, I think is the one who has control of it. But
Okay.
I'll actually have a PowerPoint ready for us, at least like a sample one for us to try and click through on next Monday.
Okay.
Okay.
Thanks, Natalie.
Yeah, so let's see. I can stop.
You'll have to share with me later how you did that.
Yes, I will. All right. So
is everybody good to meet next Monday to review?
Let me just double check my.
yeah, I think I'm free.
Okay.
Let me see here. Yes, I am.
Okay, me too.
Okay.
Oh, perfect.
Great.
And then do we want to set, since next Monday we're just reviewing, do we want to set a date for when we're actually going to do the present?
We might as
Oh,
well.
Yeah. I mean, I also wonder
I hate-
if it
go
all
ahead.
happens to look good, would you be opposed to just recording it that Monday?
I think that would be awesome. Just
Yeah,
to do it
yeah.
all in one night if we can.
Yeah. Otherwise, we can set
Yeah.
up the backup time.
I think that's a good
Yeah,
idea. Maybe evaluate.
Yeah, I think
Yeah,
try to have everything as completed as we can.
Right, but I did see on her notes that she felt like we were going to have to meet more than once over this, but who knows? Maybe we could just be you.
Yeah, and I think I'm happy to talk to text and stuff too if that works out in the weekends.
Okay, yeah, me too.
Sorry, what'd you say?
Email or text message too during the weeks.
Oh yeah.
Yeah, me too.
Should we do
Well, for everybody.
7 again?
Sure.
Okay.
Or Mariel, if you're going to try to get home, should we do it at 7:15 so you don't feel rushed?
If that's not too late.
Oh yeah, that's fine.
No, that's fine.
Okay.
Mhm.
Thanks.
Okay, so how do we want to split this up? Unfortunately, I don't think PowerPoint has the option for a Google Docs, but I don't use Google Docs enough to know that. But
Yeah, I don't know either. I'm fine with doing whatever anybody wants me to do. So
Me too.
Same.
I don't really mind. I'm not the best at putting PowerPoints together, so I probably shouldn't do the beginning half if that person is in charge of
Yeah,
compiling.
me neither. Me neither.
Not very savvy when it comes to
I'm
PowerPoint.
happy to take on the project of being the PowerPoint compiler.
Okay. Do you want to do 1 through 5 then?
Yeah, I can do that.
Okay.
And
I can
I'm
do
happy to help anybody.
I can do 6 through 10. I mean, it doesn't matter, but
Yeah, that's fine.
I could do 11 through 15.
Okay. And I'll just pick the end.
I might
Okay.
do on
I'll
this.
do
Do we want to
16
touch
through
base
20.
on each of? Do we want to touch base on each of these slides, just to discuss? Because like some of them are, you know, how will we measure our learning outcomes? You know, will we have a, you know, return demonstration questionnaire? I don't know if we want to talk about through each slide
yeah.
Good.
just to make sure. So I think, like I said, I think 1 through 5 we've done already. We have those kind of squared away.
Mm-hmm.
So describe the identified health deficits that pertain to our population. This should come from your research your team conducted in the literature. This is where your data collection and your research comes in. What have you learned about your population's health deficits? So do we want to discuss like some of the deficits we found with our personal assessments that we conducted with our tool?
Yes.
And then just some of the other things in the literature?
Yeah, that would work.
So some of the deficits I found were like poor environments, like habits being formed from environments. And then in the literature research, I found that you're more likely to be inactive if you're eating or drinking bad foods. So, or like sodas, you're less motivated to work out, with less energy.
Yeah, and I found nutrition was a big part on mine, that I determined that lack of nutrition education.
Yeah, that's what I found too, that people don't know what they're supposed to eat or what what a healthy BMI is or how to even check your BMI, which I think a lot of people might like to know. It's simple. There's like lots of parts, but people don't even understand.
Yeah.
Yeah. And I found like insufficient knowledge about screening or what complications could arise from diabetes.
Okay. And then describe your team's proposed intervention and how it is based on existing theory and evidence. Once again, refer to your data and what literature is saying.
Well, our theory, that goes along with our theoretical framework, and we chose the social ecological model. Was that correct?
Mm-hmm.
That is
so
correct.
that encompasses individual, social environment, physical environment, and policy and organizational factors. So I think all of that fits in.
Mm-hmm.
Lifestyle, activities, the environment, individual strategies and influences, educational programs, support groups, all of that. That all flows together. It's a really good model for this.
Yeah.
I agree.
And you know what? I found a quote. I don't know if we want to use it, but I wrote down, health starts where we live, learn, work, and play. And that actually came from the Healthy People 2020. I just thought that was a good theme.
Maybe we could put that on like the thank you slide.
Yeah, that might work.
I think that sounds great, and that's a great quote.
Yeah, what was it again, Kathy? I'll write it down under my portion.
It says, I don't know, I was like taking notes when I didn't have anything else to do on the social and I wrote down, health starts where we live, learn, work, and play. And then it said health equity, attainment of highest level of health for all people, and the elimination of health disparities. And then I just put healthy people 2020. But I like the health starts where we live, learn, work, and play, because that's everywhere.
Right.
Yeah.
Okay. That's
Perfect.
That's cool. All right.
So yeah, that essentially answers, well, slide 8, our theoretical framework that will support our intervention. So that's good. Describe the methods, materials, and or procedure for implementing the intervention. Remember, you only have 20,000, which we kind of.
So that's our health fair. 20,000 is a lot for a health fair, so we got to figure out what we want to do with that 20,000.
Yeah.
Methods, materials for implementing the intervention. I can talk to our PR guy at our hospital because he does health fairs.
I was going to say, what if we're doing this on a college campus? What if we have some sort of, weight loss, like where we track people's weight loss? They let us know how they're doing, and we could have like a $5,000 scholarship that they could win with it.
Oh, that's a good idea.
Because that would, cover that would still give. We're well within a good budget for, submitting the health fair. I think we'd still be way under budget because health fairs I don't think are too expensive to do.
Yeah, I think
and maybe we could, for people that come, maybe we could give them raffle tickets and then have prizes like Fitbits.
Yeah.
Oh, yeah.
I honestly feel like our biggest cost is just going to be reserving whatever the area is on the college campus, because if we're bringing in all these other people, they'll probably do it for free, just for volunteer work. And even maybe some of the prizes we can get donated, but we can.
Oh, I have an idea. Since we're doing it at a college and colleges have nursing schools, and I know that we've used some nursing students for some big projects with the March of Dimes, but maybe we could get nursing students to help. Sometimes they have to do community.
Vital signs.
They have to do projects.
Absolutely.
Okay. And then for number 10.
How will you measure learning outcomes? Will you have them conduct a return demonstration, questionnaire? Will you measure body composition? If so, describe the specifics. I need to know how you will determine if your intervention will make a difference.
What are our outcomes then that we're going to measure? I think we're doing a lot with this one fair. I think we'll have a lot of different outcomes. Which isn't bad.
Right. We're wanting to talk to them about nutrition. So we could have an outcome that has to do with learning about nutrition.
Maybe for nutrition, we can do like a pre-test, post-test kind of thing, or just like a survey after they attend.
Yeah.
If we go thing. That will be measurable.
Yeah, we could do pre-test, post-test.
I think another thing we could maybe do is if they end up signing up, for gym memberships or something through this health fair, they can get the discounted price. But with that, we get to see if they're, 3 months from now, see how often they've attended just for our own purposes. Maybe.
Yeah.
Well, and I don't know what you think about this. Sometimes my ideas are kind of weird, but it says, will you have them conduct a return demonstration? Well, if we're going to teach them at the health fair about nutrition and maybe the MyPlate from the, what site is that on? The MyPlate.
I think it's myplate.gov.
It's USDA.
Yeah, yeah.
Yeah. I don't know, but maybe if we had some information on what constituted a healthy meal, like a lot of people, honestly, even young adults don't know about what makes a healthy meal, about the 4 food groups. Childbirth classes, I know this is kind of silly, but I had a lot of fake food, like broccoli and milk or whatever. So I don't know, maybe we could make a game out of it, and a return demonstration is before they leave the health fair, they can set up a healthy meal, and then we can give them a ticket for a drawing or something. I don't know. That's
I think that sounds
one way to
great.
measure whether they
Mhm.
learned something or not, is if they can return demonstrate what makes a healthy meal.
Yeah, I like that.
Yeah.
And then as for screening, were we going to do like this blood pressure screening or actual labs? Like sugar, glucose checks?
Oh, glucose check would be
Yeah.
good, Mariel, because that's, I mean, obesity and diabetes kind of go together. Diabetes type 2, we can just do a random glucose check.
Yeah, and we'll definitely do body weight and blood pressure screenings. We'll calculate their BMI, and maybe we could have a where we could teach them how to actually measure their waist circumference and have education about that.
Hmm.
Return demonstration. So then how would we measure that outcome for the screening? How would we could do like the return demonstration on the waist circumference.
Or looking up their BMI.
Mm-hmm.
Then they can go home and look everybody else's BMI up too.
Yeah. Be able to verbalize how to calculate a BMI.
Mm-hmm.
Okay.
Which one are we on now?
11.
11. Describe how you will evaluate the project. I need to know the steps that your team will take to ensure that all components of the project are working throughout the duration of the intervention. Will your team develop an intervention guide for all members to follow? Will you measure participant nutrition?
I don't know how we would measure participant attrition with a health fair.
Yeah.
But that doesn't mean, just because it's there, it doesn't mean that that has to be one that we deal with, as long as we come up with a way to evaluate the project.
Right.
Which could be a survey.
Could be a survey. We have a pretty decent sized budget. That I wonder if we had a fall, like schools just starting fair, and then do one in the spring, and have a second fair, and maybe we could have that. We can have some sort of data on them and have a follow up that way.
Oh, I like that idea, because then that will get them to come back, and if we
and it gives them like 6 months or 5 months in between when we first do our initial education, and then do a follow up to see how well our screening tool and our interventions worked.
Mm-hmm.
And that could tie into slide 10 and measuring certain things. We can kind of on one and then test on the next.
Okay.
All right. So convince me that your project is innovative and exciting.
Well, I'm innovative and excited. I want to go to this health fair.
I know, it sounds great. I can win a Fitbit. Might get a scholarship.
Yeah, we could just put all like the fun things that you could gain from coming to the fair, participating. Maybe like a fun little picture of like healthy college age students on it or something.
Yeah, and maybe the $5,000 scholarship, or however much we decide to do as a scholarship, maybe it will be for whoever shows the most improvement, or I'm not quite sure how we would measure everybody's improvement though.
Mhm.
Maybe
Um,
weight loss.
Yeah, I mean, weight loss, or yeah, probably, or changes in their BMI, or because I mean, ultimately, I mean, if they're making better nutritional choices, most often you'll probably see related changes with weight and everything as well.
Well,
Mhm.
maybe we could include the gym membership in that. And so the person that signs up at the first health fair that goes to the gym, loses weight,
Mm-hmm.
does all that, then they're the one that receives the scholarship. So you'll have people that are really trying, because especially college age students that need money for school.
Totally.
Mhm. Okay.
All right. Describe how you will market your program and intervention. Also, how will you go about recruiting participants? I think on a college campus we have it. It's pretty easy. I mean, we'll just put out flyers. We can have an email go out to the university a couple times, just letting everybody know about it. You know, in the nursing classes, have them have signups for the nursing students to come.
Can have like the nursing students like promote it too.
oh yeah.
I don't know if you guys
So,
ever have to do anything like that in undergrad, but like promoting something healthy, they could hand out flyers too, like in the cafeteria or something.
yeah. But before I went to school for my undergraduate degree in Northern Arizona University, but I
Mhm.
originally was going to U of A for my start of my undergrad. And I was part of their pre-nursing program, and they had a
Oh
lot of
yeah.
things like this where you had to like recruit people and you know, to go to certain events, and you'll get little points, and then you can, you know, remain active in the pre-nursing program.
Uh-huh.
I think that that would be a good group to reach out to as well.
Uh-huh.
Perfect. I think the U of A has that too.
And then describe how you'll use the 20K. I feel like we've gone through that, but
And I wrote it down, so I have
okay.
ways to that we're going to reserve the scholarship, and
Mhm.
then maybe like the raffle tickets and maybe some prizes, and everything else we're going to assume is going to be free. Volunteer based.
Yeah.
Is I missing anything?
Perfect.
Okay. Time frame needed to develop, implement, and evaluate the intervention should be within 1 year.
So what we determined it'd be kind of like 5 or 6 months. So if we did the health fair in September and then redid it in April, that
Mhm.
would be, I think, 6 months.
Awesome. And then how long do you think it'll take to like put all this together and coordinate everyone, and then give them time to?
Yeah. I would say
I
2
think,
months would be adequate.
yeah, I would say 2 to 3 months. No
Mhm.
more than 3 months, and a little bit more than a month at least. So 2 to 3
Mhm.
months.
Yeah.
And evaluation, will that be right after April? So evaluation like a month.
Mhm.
Yeah. So describe strategies for sustaining the intervention after completion of the funding year. I think if we realize that it was a success, that is something that we yearly implement at the college campus.
Mhm.
And maybe if it's successful on the college campus, we can figure out other
Venues.
places that we can try and implement this as well, that young adults go to.
Mhm.
The only thing I'm worried about is slide 16, describe strategies for sustaining the intervention after completion of the funding year.
Well,
I have a feeling, I have to look at the textbook again, but I have a feeling one of the textbooks discusses something like that. Strategies for students.
Well, let me look here.
I might be confusing it. When we did that health promotion plan, there were strategies for behavior change, I think it was, and not sustaining.
sorry,
I know.
Mary, I couldn't really hear you. What did you say?
I might be remembering it wrong. I remember when completing that health promotion individual plan,
Mhm.
that it had asked for strategies for, I think it was behavior change. So I might be.
Oh, okay.
I know, with the nursing program helping, they can continue on. That would be good for sustaining another health fair.
Mm-hmm.
You might not be able to give a scholarship because that would be dependent on funds, but I know with the grant that I worked on for Baby Friendly, we had like $750,000 from our hospital given to our hospital. But
Mhm.
then at the end of the 5th year, the whole last year was on sustainability of the grant because they wanted to keep the program going, but without money. And it was really hard to come up with ways to figure that out.
Sure.
Mhm.
So one of the ways, I guess, would be to involve the nursing program because there's no money involved in that. It's just time. So it would just be a commitment
Mhm.
for continued help.
Yeah, just have the nursing program maintain annually.
Mm-hmm.
That way it doesn't just kind of disappear.
Yeah, I mean, they may not be able to have a big scholarship, but they could still carry on with the health fair.
Mhm. Okay, and then describe how your intervention will fit into existing DRHA programming and resources. How can the two exist together long term?
Let's pull up. I know there's a thing about the DRHA mission, vision, values, and plans. So I wonder if we can tie it in with like their mission.
I'm sure because they will align together.
Yeah.
Mm-hmm.
And is that asking if how would we? I mean, who are we? Are we like a separate entity, or are we just a part of the DRHA? Are we employed by the DRHA?
I take it that we're part of DRHA.
Okay. So existing.
Yeah.
We could say something like if it's successful, the DRHA is willing to commit so many resources to kind of like an obesity prevention program.
Yeah, I think that would be great.
Okay.
I think she's probably, in reality, a big project that you would put together would be a lot more than a week or two So I don't think she's looking for us to have every little thing planned out, but just kind of an idea, and that we can work together and, you know, hit what we need to hit. I have a problem sometimes because I'm a perfectionist. It's like I think, okay, well, we got to do this and we got to do that, and we don't really have to make it that stressful or complicated.
Yeah.
Yeah. Are we ready to go on to 18?
Yeah, I think so.
Okay. Describe why the DRHA and surrounding community would support or need an intervention like yours. Will they buy into your program? Is it sellable to the community? Convince me.
Oh, I think that's an easy one. This is like a perfect. Why would they not support it? Obesity, diabetes, the amount of money that's spent and the number of people that are affected. It's a worldwide epidemic, obesity and diabetes. So doing something healthy really aligns with DHRA's mission and values. So I think it's totally sellable.
Absolutely.
We just have to be excited about it. And
yeah, and I think it's
okay.
Yeah, very much so. All right. Summarize your project. Convince me that your project will promote health in the target population. This is your conclusion slide and the one that may finally convince me. So.
Oh, geez. No pressure.
Who's doing that? Is that you, Sarah?
Hey.
You're perfect for that. You're very convincing. That's where you could use that quote.
Oh, yeah.
Health starts where we live, learn, work, and play.
Yeah. I'm sure I could come up with something if I had enough time to
And
think
slide
about
number
it.
20, that's an easy one, girl. Just put thank you on there.
Thanks, bye.
For sure. Yeah, I think we could also bring up too, like convince me that this will help promote health in the target population. I mean, you can bring up like the freshman 15 and stuff like that. If we're starting this in the fall, help prevent that. And
freshman 15. How about the graduate school 15? You know how many pounds I've gained in the last year? 15, exactly.
We need our own health fair.
Yeah.
Yeah, I hear that. I'm with you there, Kathy. All right. So
all right, guys.
I think we kind of got everything all split up. So if you, let's see, I work middle of the week this week, and then I work Sunday. So if you guys just want to have what your parts to me by, let's see, probably by Sunday, and then I'll get everything put together Monday when I get up. Okay. And that way we'll have it all put together and ready for our meeting next Monday night.
So you'll just change the font and everything to make it all the same.
Yeah, and if you just send it to me in a Word document.
Okay, you can stick it on the.
Just put slide whatever slide number it is, so I know kind of which questions it goes along with, and then I'll put it into the slide and get it all squared away there.
Oh wow, okay.
Perfect.
If that works for you guys.
That works for me.
Perfect. Okay, so I think our due dates for this module, we don't have as many as we have. So we do have an annotated bibliography due Sunday night. Our Google Hangouts on air submission will be due Sunday night as well. And then our actual presentation is due October 2nd.
Okay,
perfect.
Good.
All right.
All righty.
And
I will get this, our Hangout posted on our discussion board.
Okay, and I'll put some meeting minutes together and get them to you too.
Perfect. And then do I need to submit the Google Hangout onto the assignments also? Or is that it?
I think there's actually an assignment, like an actual Dropbox for it.
Okay.
There is. You just have to take the link and put it in the Dropbox.
Okay. That's good.
Perfect.
Okay.
All right. Well, and I'm happy being I kind of have the easier section on this. I'm happy to help if you guys need help with any of your sections. So just let me
I
know.
don't think you have the easier section, though. I guess that's all a matter of opinion, but I'm glad you think it's easy.
Yeah.
I think formatting is the hardest part. So thank you.
Yeah.
Perfect.
All right. Have a good week, you guys.
Yep.
Okay,
Chat
bye.
soon.
Bye.
Bye.